Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people with shoulder impingement syndrome. Tip number 1 is know when to suspect that you may have shoulder impingement syndrome. Shoulder pain is the second most common cause of pain in the general population after back pain. And shoulder impingement syndrome is the #1 cause of shoulder pain. People with shoulder impingement syndrome usually start having symptoms after about age 40, unless they are an overhead throwing athlete. In other words, an athlete who does exercises that involve throwing overhead. Then they usually present at a younger age. Person with shoulder impingement syndrome usually has a history of repetitive overhead shoulder activities and usually begins having pain with reaching and can have pain with daily activities such as putting on their shirt and brushing their hair. The pain is often worse at night when lying on the affected shoulder. Tip number 2, if you think you have shoulder impingement syndrome, see your doctor. There are important other possibilities as causes of shoulder pain that your doctor will need to rule out when doing your shoulder exam. The examination that your doctor performs usually will include testing of range of motion, including the painful arc test to see if you have pain with lifting your arms up out from your sides, testing rotator cuff strength, including the drop arm test, and testing for external rotation strength. Your doctor will also use special tests to test for shoulder impingement syndrome, such as the Neer and the Hawkins-Kennedy's test. Tip number 3, if you do have shoulder impingement syndrome as diagnosed by your doctor, and your symptoms have begun in the past 3 months, so it's an acute onset, then it's likely that you'll benefit from ice. Ice is recommended. You can use it for 15 minutes at a time every 4 hours for relief of swelling, and it can also have some relief of pain and inflammation. Tip number 4, rest. If you do have shoulder impingement syndrome and the symptoms have just started, it's important to avoid activities that make the pain worse, as well as to avoid all overhead activities. Tip number 5, if the impingement has started recently, then naproxen, which is a non-steroidal anti-inflammatory drug, should be used for 7 to 10 days scheduled. So not just when you're having pain, but every 12 hours, 500 milligrams of naproxen during the acute symptoms of a new shoulder impingement syndrome. Non-steroidal anti-inflammatory drugs should not be used on a scheduled basis for a long term because they can increase the risk of gastrointestinal ulcers as well as high blood pressure and heart attack. But for a short period of time on a scheduled basis, they are effective in relieving pain and reducing inflammation. And they can be used as needed on an as-needed basis over the long term. Tip number 6 is physical therapy. Physical therapy is an important and probably the most important part of rehabilitation when you have shoulder impingement syndrome. So either you can go to a physical therapist yourself or be referred to one by your physician. Tip number 7, home exercises. So there are important home exercises to do in addition to physical therapy that you do with a physical therapist to help rebuild your flexibility and your strength once you have shoulder impingement syndrome. These exercises can be prescribed by your doctor, by your physical therapist, but generally they'll include starting with a heating pad for 5 minutes each day before you start the exercise. It's applying the heating pad to your shoulder area. Some of the more popular exercises to perform are a pendulum stretch, where you bend over at the waist with your hand dangling out of the affected arm, and you basically are moving your shoulder in a rotational direction or back and forth and side to side. You can do that for daily, and you can end up by holding a weight in your hand and increasing the weight by 1 pound each week to improve your strength. Another popular and effective exercise is the scapular squeeze. In the scapular squeeze, you lie on your back with your knees bent and your arms about a foot out from your sides with your palms facing up. And basically what you're doing is you're squeezing your scapula, which are your shoulder blades, together. And you're avoiding shrugging your shoulders or tensing your neck. So you're trying to bring your scapula together as you lie on the ground. Each time you try to bring your scapula together, you hold it for 5 seconds, and you repeat that for 20 repetitions daily. And the third effective exercise to try is an outward rotation exercise, where you hold a rubber band in your hands with your arms bent to 90 degrees and your elbows onto your sides. And basically with this stretch, you're pulling the band of the affected arm about 2 to 3 inches externally, in external rotation. And you are holding this for 5 seconds in the outwardly rotated direction. Tip number 8, subacromial injection. If you do have acute shoulder impingement syndrome and the pain is preventing you from doing physical therapy, and the pain is preventing you from being motivated to improve your shoulder strength, then an injection of a steroid into your subacromial space can be effective in improving your ability to participate in physical therapy. Ask your doctor about a steroid injection if you are having these symptoms. And tip number 9 is referral to an orthopedic doctor. If after about 6 months of the conservative therapy I've mentioned, which is ice, rest, 7 to 10 days of naproxen, physical therapy, and home exercises, and a subacromial steroid injection, if after 6 months of these therapies you still are having persistent pain and limitation of function, then a referral to an orthopedic surgeon is appropriate for possible consideration of other causes of shoulder pain, as well as consideration of surgery. And tip number 10 is believe in yourself. Once again, shoulder impingement syndrome is a very common condition, and these are, I hope, will be helpful to you in identifying and treating your shoulder pain. I hope these tips have been helpful. Thank you very much for your time, and have a great day.